Mr. Deputy Speaker. May I start by giving my thanks also to the Honourable Member for Ealing and Acton, who can't be with us today, but who's a fantastic ally of mine in this campaign to help protect our public. Today, the nation is facing the second peak in the worst health crisis in living memory. To date, nearly 85,000 people have died. In November, the death rate was 175 fatalities per million. In December, that figure was 222, and it looks as though January will be more than 324. To deal with this catastrophe, the government is reluctantly instituting tough lockdowns and considering even tougher ones. Now, whether these measures work is disputed by some, but there is no doubt that they are incredibly costly in economic damage, in individual freedom, in mental health, and even in lives lost to other causes. And as the death rate per million climbs month by month from 175 in November to 324 now, the strategy certainly isn't working as well as we would hope. Now compare that with the province of Andalusia in Spain, a Spanish province of over 8 million people, who started with a situation in November worse than ours, 189 deaths per million as against our 175, but who have cut their death rate by at least 2/3 whilst ours was doubling. That reduction from between 50 and 70 deaths a day in November to between 5 and 15 deaths a day currently started immediately after they initiated a programme of issuing calcifediol, the fast-acting high-potency form of vitamin D, to at-risk groups, including care home residents. So the first thing I'll ask the Minister to do, not today obviously, but afterwards, is to look closely at that policy experiment and see whether vitamin D was the key to what is a spectacular success in cutting death rates by anybody's measure. I believe the government in Madrid is reviewing it, so should we. For decades, researchers and medical professionals have been warning there is a pandemic in vitamin D deficiency, with more than 1 billion people worldwide being vitamin D deficient. The warning bells for this ignored pandemic have been ringing long before the World Health Organization declared the outbreak of Covid-19 as an official pandemic on the 11th of March last year. And those warnings should have been especially loud in the UK, whose vitamin deficiency levels have been described in a recent research study as alarmingly high. I will indeed.
Would the right honourable gentleman agree that the children precluded, for the reasons that are very obvious, from taking the vaccine at this time? It's clear that we need to be proactive in building their immune system. So would he join me in asking the Health Minister and the Health Department to work with the Education Department to provide free vitamin D to every school-aged child, as I have asked the Minister in Northern Ireland to do the very same?
Well, an excellent idea. I do join him in that request. I think it's a very good idea indeed. Now, it's long been understood, on the question of education, medical education, it's long been understood that vitamin D plays a critical role in calcium uptake and the prevention of diseases such as rickets and osteoporosis. That was what it was thought to be its main effect. But since 1983, there's been a large amount of research demonstrating its critical involvement in the body's immune system. Many of the mechanisms involved are now very well understood. By 2017, it had been clearly shown in a number of randomized clinical trials that vitamin D deficiency was a very significant issue in acute respiratory disorders, flu, colds, pneumonia, the lot. And correcting the deficiency with supplementation could reduce the severity of symptoms by as much as 70%. This and other research showed that vitamin D had a critical role in the activation of both the innate and the adaptive immune systems, and in modulating some of their responses, most notably the now infamous cytokine storms. Deficiency of vitamin D led to compromised immune systems, and as a result, susceptibility to a number of diseases, most particularly respiratory diseases, but of course also COVID-19. Now yet, despite this evidence to suggest vitamin D has a wider health benefits than just bone health, and despite our particularly exposed situation in the UK, our public health bodies have done little to correct this problem. At the beginning of the COVID-19 crisis, several well-respected research teams noticed a high correspondence between low vitamin D levels, deficiency in the blood, and severity of COVID-19 symptoms in patients. Early evidence suggested a strong link between the two, with studies showing that 40% of patients who suffered severe COVID-19 outcomes were vitamin D deficient, compared with 4% of those with sufficient levels of vitamin D. Moreover, mortality rates of deficient patients, vitamin deficient patients, were dramatically higher than for patients who had sufficient levels of vitamin D. Now, these were correlation studies, so they weren't proof of causality, but they were massively indicative, given the prior evidence of the importance of vitamin D to the immune system. So this was startling evidence. Therefore, in early May last year, I wrote to the Health Secretary calling on the government to urgently review the available evidence to assess the role vitamin D could play in helping us to combat this dreaded virus. And the Health Secretary quite reasonably handed this work to his health advisors and ordered them to undertake a rapid review of the evidence. NICE attempted to analyse the statistical data and came up unconvinced. The problem is that correlation is not a proof of cause and effect, and a correlation, albeit a strong one, was all that we had at that point. In effect, NICE said that more data was necessary. Now, you would think at this point that they would have initiated a large, well-designed, random control trial to pin down the question, is vitamin D a causal factor in bad COVID outcomes, in morbidity or mortality? After all, it was an incredibly serious disease, and this is a very cheap and safe treatment. But not only did they not do this, the two applications for random controlled trials for funding to carry out such trials were turned down. However, since then, more general global evidence in many other countries has grown in strength, which makes the inaction all the more questionable. Several studies have been published showing how vitamin D levels lead to poorer outcomes for COVID-19 victims. In September 2020, the results of the world's first randomised controlled trial, the gold standard of medical research on vitamin D and COVID-19, were published. The trial, conducted in the south of Spain at a hospital in Cordoba, involved 76 patients suffering from COVID-19 sufficiently badly to have been hospitalised. 50 of the patients were given vitamin D, the remaining 26 were not. Half of those not given vitamin D were so sick, became so ill, that they needed to be put in intensive care. By comparison, only one person of the 50 who were given vitamin D required ICU admission, just one person. Put it another way, the use of vitamin D seemed to reduce a patient's risk of needing intensive care 25-fold. 25-fold. Other studies have shown, at a statistically significant level, large reductions in mortality too. There was an experimental study conducted at a nursing home in France with 66 participants. The outcome of that study was that taking regular vitamin D supplements was associated with less severe COVID and a better survival rate. There's evidence from United Memorial Medical Centre and Sintara Norfolk General Hospital, both in the US, which show that they can get a more than 75% absolute risk reduction, risk of death reduction in mortality when treating patients with a cocktail of treatments, including vitamin D. And researchers at the Eastern Virginia Medical School who designed the protocol estimate that if their approach, including vitamin D, to patient management was widely implemented at the start of the pandemic, it could have saved many, many, many thousands of lives. Now, the results of these studies are stark and clear-cut. And what was originally dismissed in some quarters, is now backed by leading medics around the globe. Richard Carmona, the 17th Surgeon General of the United States, has said, and I quote, "The response to the pandemic should include an effort to aggressively eliminate what is becoming apparent as a morbidity and mortality risk factor in COVID-19, vitamin D deficiency." Now, Dr. Carmona pointed out that the classical criteria for dealing with correlation evidence was ironically drawn up in Britain, drawn up in this country, by the great British physicians Sir Austin Bradford Hill and Sir Richard Doll in their study of smoking and lung cancer. They deduced you could use correlation data to show causality if you could show a certain number of other conditions: consistency of evidence, specificity of the evidence, dose responsiveness, and what they call temporality, which basically means what happens first is the cause, what happens second is the effect. It's fairly obvious when you put it in English. The simple fact is you can show all of the Bradford Hill criteria are met for vitamin D and COVID-19 if you look at all of the many separate, individually small, but collectively enormously persuasive studies. Every single one of the criteria can be seen to be met, which is presumably why Dr. Anthony Fauci, famously the head of the US coronavirus task force, a difficult job at the time, is quoted as saying, there is good evidence that if you have a low vitamin D level, you have more of a propensity to get infected. These are serious voices now backed up by serious evidence. Now, to give the government proper credit, they have instigated the provision of a supplement free of charge to the clinically extremely vulnerable in care homes. However, if supplementation is to have any material effect, the dosage has to be sufficient to correct the existing deficiency. Sadly, with the government's programme for the clinically extremely vulnerable, the supplementation falls far short of this. The government is providing supplements of 400 international units. Now, this is in line with what the National Health Service currently recommends to tackle issues surrounding bone health. By contrast, the American health authorities recommend 600 to 800 units, depending on age, and the latest research from the Royal College of Physicians recommends that health authorities should urgently recommend a higher supplementation of 800 to 1,000 units a day. This would more than double the current daily recommended dose of the vitamin D. But even this is not high enough. It's based on bone health, and enough to provide the additional benefits and protect against respiratory disease such as COVID-19 with existing deficiencies is much, much higher. You know, we're not aiming to protect the people who are in elderly who are in care homes from rickets. We're aiming to protect them from a lethal disease, which is a very different issue. And the vitamin is safe in quite high doses. In the summer months, you could sunbathe for 30 minutes, Mr. Deputy Speaker, and get the equivalent of 20,000 international units, much more than you would take in a daily dose. All the modern toxicological evidence indicates that if there are any deleterious effects at all, they don't happen until a much higher dose than that, much higher than 20,000 units. Even the National Health Service, who's very cautious on this, accepts that a dosage of 4,000 units a day is perfectly safe. It says that on its website. What is needed to provide adequate protection against COVID-19 is a significantly higher dose, up to 4,000 units a day, particularly for those vulnerable groups that tend to be deficient in the vitamin, namely the elderly, the ethnic minorities, and a number of those suffering from a number of medical conditions. Now, the action of extending or providing supplement to the clinically extremely vulnerable in care homes is a small step in the right direction. However, it's a drop in the ocean when compared to the action the government should be taking overall. There needs to be a wider scheme providing supplements to all at-risk populations, including the elderly, the obese, minority ethnic groups, diabetics, people with high blood pressure, and the like. Doing this will be a tiny cost when compared with the other health initiatives. A year's supply of a daily dose is likely to cost about £15 a person. So if you allocated this to the identified risk groups, this would amount to 45 million. To these, plus every ethnic minority citizen, about 200 million. To every clinically obese and at-risk person in other categories, a little more. But these figures could be halved if the risk was more severe in winter months and you just gave the dose then if you thought that was an issue. But the benefits would be enormous. That cost is a mere rounding error when you measure it against the cost of not defeating the pandemic or indeed the cost of a lockdown. It's a rounding error in that context. Now, it's by no means a coincidence that the United Kingdom has one of the worst mortality rates in the world. After all, we have one of the worst rates of vitamin D deficiency in the world, about 40% of the population, and with that we have the very high levels of compromised immune systems. Yet Public Health England continues to refuse to acknowledge the growing evidence linking vitamin D deficiency and poorer COVID-19 outcomes. For this, we're now paying the price. Vitamin D could be one of the tools that helps turn the tide in the fight against this terrible virus. Vaccines, of course, are now being rolled out, but they will still take some time to reach sufficient levels, where sufficient that lockdowns are no longer needed. The government's doing a great job on vaccines, but there are limits to what it can do. And unlike the general effect on the immune system of vitamin D sufficiency, vaccines are very specific. And if you have a sufficient mutation, the vaccine can be rendered obsolete. That is not true of vitamin D. In the meantime, vitamin D supplements could be provided to all at-risk groups more quickly and at a lower cost. Now, the UK has now had, as I said at the beginning, nearly 85,000 COVID deaths. It's long past the point where we try anything with even a marginal chance of success to prevent those deaths rising even higher. Well, vitamin D has a much more than marginal chance of success. We now have good reason to believe that vitamin D supplementation will help reduce mortality from COVID-19, and we have good reason to believe it will cut susceptibility to infection. It will save lives, improve population immunity, and help reduce the medical and economic impact as we continue the universal rollout of vaccines. There is now no reason not to act. After all, in the Secretary of State's own words, supplementation has no downsides. He was right. There is now no reason not to act. After all, the Surgeon General I quoted earlier said that we should not let COVID-19 patients die with vitamin D deficiency while we wait for perfect evidence. Vitamin D is cheap, it is safe, it has many other proven health benefits, and as the government of Andalusia has shown, it could be a dramatically effective weapon in our fight against COVID. There is no more time to waste. The time to act is now, Minister.
Minister.
Thank you very much indeed, Mr. Deputy Speaker. I am extremely grateful to my right honourable friend, the member for Halton Price and Howden, on securing this debate, and also to the honourable member for Strangford, for whom it wouldn't be an adjournment debate if he didn't play his part. As we have always said, the government consistently reviews the latest data and information as it emerges on COVID-19. This, of course, includes the progress we've seen in treatments for those suffering with the virus, as well as preventative measures. And here I would like to express my thanks, and I'm sure Right Honourable and Honourable members from the House will join me, to the health and care workers and the scientific community whose dedication and hard work have made this possible. Over the past months, there have been reports about vitamin D's potentially reducing the risk of coronavirus, and I'm aware of colleagues' interest in the relationship between vitamin D and COVID-19. And I really welcome the opportunity to discuss it today, because I think, as he says, nothing should be taken off the table, and we should be constantly vigilant to new science and information. There are several nutrients that are involved in the normal functioning of the immune system. However, there is currently insufficient evidence that taking vitamin D will mitigate the effects of COVID-19. In collaboration with PHE and the scientific advisory community on nutrition, NICE have published, which he mentioned, a rapid guideline on vitamin D in relation to COVID-19. That data was reviewed by an expert panel and included the best available scientific evidence published so far, including both randomised control trials and observational trials. The expert panel supported current government advice and the recommendation for everyone to take a 10 microgram vitamin D supplement throughout autumn and winter. However, the panel concluded that there isn't currently enough evidence to support taking vitamin D in order to help or treat COVID-19. There are still significant gaps in the current evidence, and studies to date haven't reached the high level of data quality required to revise the guidance. And I heard what he said about not wasting time, but the Spanish study to which he alluded was actually, as he mentioned, only 76 participants, and actually very small studies. The smaller the sample group, the more challenging sometimes to actually draw the effect. We are also dealing with very poorly people who have multiple different factors affecting what and how they are responding to. So making sure that we can rely on that data is important. Indeed, there was a good double-blind trial before Christmas that showed no effect. However, currently at Queen Mary's University, there is a large-scale trial going on, and I hope when that reports later in the year, that will give us some good clarity. The current evidence base is mixed and dominated by, as I say, not always great quality studies with substantial concerns around bias and confounding. And at the moment, they're unable to demonstrate that causal relationship between vitamin D and Covid-19. This is because many of the risk factors for severe Covid-19 outcomes are the same as for a low vitamin D status. And due to the lack of reliable evidence, the NICE guideline recommends that more research is conducted. Government guidance continues to stress the use of high-quality randomised control trials in future studies. There are 70 trials underway either in the UK or internationally, and amongst these trials there are some very high-quality ones that will answer key questions from NICE, Public Health England and SACN. And they're monitoring this new evidence, so he asked for my assurance that we're doing that, and I can give him that this afternoon. The long-standing government advice is that between October and early March, everyone is advised to take a supplement containing 10 micrograms or 400 international units of vitamin D a day. Vitamin D helps regulate the amount of calcium and phosphate in the body and protects bone and muscle health. And in April and autumn 2020, PHE reiterated its advice and also ran a marketing campaign throughout December 2020. This had, because the Right Honourable Gentleman alluded to it, it had a specific focus also on those communities that he mentioned, so in particular the BAME community, where vitamin D supplementation is very important. PHE advice to continue taking vitamin D supplements is also very important for those who are shielding, care home residents and prisoners, for as well as those who choose to cover most of their skin when they're outdoors, and also importantly, BAME individuals, as he said, are more at risk of not having high enough levels of vitamin D. They are advised to take a supplement all year round. So, we are actively supporting the uptake of PHE's recommendations to ensure those who need vitamin D supplementation receive it, and the government's providing a free 4-month supply of 10 microgram vitamin D supplements. These are received by all adults on the clinically extremely vulnerable list, going far beyond care home residents who have opted in, and residentials in residential and nursing care homes in England, and the prison population, where Her Majesty's Prison and Probation Service have made supplements available across England and Wales. Through this commitment this winter, we've offered 2.7 million eligible people in England free vitamin D supplements, and to further drive uptake, we've extended the registration period to the 21st of February, so even more people can benefit. The government has prioritised groups that were asked to stay indoors more than usual over the spring and summer due to national restrictions. In addition, recipients of the Healthy Start scheme are also offered access to vitamin supplements by the government. And of course, it's possible that GPs and pharmacists may be approached for general advice on taking vitamin D. However, we do not expect this measure to place any additional burden on either of these groups, who are under some pressure at the moment during the current pandemic. Guidance can be found online, and we encourage individuals to buy 10 micrograms of vitamin D supplements, which are easily available from supermarkets, chemists, health and food shops. We must keep looking at the evidence, and in the meantime, as that research continues on the impact of vitamin D on Covid-19, we will continue to monitor as it is published in real time. We have committed to keep this under review. PHE, the Scientific Advisory Committee on Nutrition, and NICE will update advice if and when necessary. And, of course, I welcome any further studies into this emerging area. I know the Honourable Member wants us to move at pace. He enters everything he does with enthusiasm and vigour. However, I'm sure he'll agree that we are nudging along. Some progress has been made, and as well as the importance of future decisions, they should and they must be based on robust evidence.
The question is that this House do now adjourn. As many as have say aye. Aye. Contrary, no. I think the ayes have it. The ayes have it. Order. Order.